Hi, this is Pooja Sharma. My student ID is 33549971. Hi, today I'm going to describe about the topic. My topic is emerging infectious disease in wildlife and humans. What is emerging infectious disease? A infectious disease whose outbreaks has increased from the last 20 years and could increase in the near future. This definition was given by the Taylor et al. In the year 2002. There, there are so many species through which wildlife affected by the various diseases like rabies, West Nile virus, anthrax, Rift Valley fever, Lyme disease, and so on. Today, I have chosen the disease name anthrax. This is a serious zoonotic disease that usually affects mammals and particularly common in herbivores. In the upcoming presentation, we will talk about the history, epidemiology, and the impact on animal and human health and the methods of prevention. While anthrax is caused by a bacteria named Bacillus anthracis and it is a gram positive that existed in the two forms, that is vegetative bacillus and spores. It can be found nearly worldwide, having a 1200 strains, and basically it is a disease of domesticated and wildlife animals. Bacillus anthracis tends to form spores. This disease usually occurs through spores, and this sporulation requires a pure nutrient environment and the presence of free oxygen. These spores can survive for around more than decades in soil, and it is also estimated that 2500 to 5000 spores represent the lethal inhalation dose for human. And these spores are very resistant and they have long life survival, and when it taken by host, then it start germinate and cause the disease. History. The history of anthrax. Firstly, the anthrax originated in the year 700 BC, and afterwards in 1752 the first clinical description of anthrax was recorded, and then in the year 1877 Robert Koch, scientist, used anthrax in the Koch postulate, and then 1881 Louis Pasteur creates the first vaccine for anthrax, and in the 1960 there was a concern of anthrax globally, and in the year 1979 the deadly anthrax outbreak in Sverlovsk, USSR. However, in 2001 anthrax attack on America, and doctor tried to find a new form of anthrax in the year 2007, and through this from the year 700 BC until 2010 anthrax recorded. Epidemiology of the anthrax disease. While Bacillus anthracis is found worldwide, with an estimated 20,000 to 100,000 human cases each year, and this is a zoonotic disease that is primarily of animals such as cattle, sheep, goats, deer, and horses. And the most natural cases occur in the Middle East, India, Asia, Africa, and Latin America, and it usually uncommon in the US and the Western Europe. It, it usually cause in the grazing animal, and these animals become infected through ingestion of spores in the soil. The outbreaks of cutaneous and the gastrointestinal anthrax have been associated with handling contaminated and infected undercooked meat while butchering and consuming meat from those animals. Transmission. The transmission of this bacterial Bacillus anthracis is with the help of spores. As I told you earlier, that there are two types of spores that exist in two forms, that is spores and vegetative form, and it is a zoonotic disease. It can occur from animals to humans, and in human it is of three types, that is pulmonary, we can also say that inhalational anthrax, gastrointestinal anthrax, and the cutaneous anthrax. While in cattle, basically livestock, it causes a fat, death to the animals, and it is at greater risk in case of ruminants, equine, and any other diseases, and form a great result. In animal transmission, if we talk about animal, the bacteria present in the hemorrhagic exudate from mouth, nose, and anus, then oxygen exposure, basically from soil contamination through the help of spores, and you can't even believe these spores remain active for decades in the soil. Impact on animals. Many species were affected due to the anthrax, and one of the ruminants are at the greater risk, and it exists in three forms. First one is the peracute, basically in ruminants, that is cattle, sheep, goats, and antelope. Acute, also in ruminants, and other one is equine. And subacute, the chronic one, it's usually occur in the swine, dogs, and cats. In ruminants, this is peracute disease, which is very much common in ruminants, and they are at higher risk. The pregnant cows may abort, and milk production can drop down rapidly. In case of peracute, it causes a sudden death to the ruminants. In acute form, the tremors occur that leads to dyspnea and bloody discharge. The chronic one is rare, and it causes death through the asphyxiation. If we talk about the equine, in that horses typically develop this acute disease, and it causes the fever, anorexia, bloody diarrhea. Sometimes swelling may be seen in the neck, and this swelling can cause dyspnea. If a horse contracts anthrax through the insect bite, then the subcutaneous swelling occurs, and the death of the equine is usually around 1 to 3 days. Carnivores, rare in dogs and cats. And if we talk about subacute to chronic, it usually causes fever, anorexia, weakness. necrosis and gastrointestinal tract. Sometimes that due to the toxemia and septicemia. Human transmission. The anthrax may be transmitted through the three forms through cutaneous, inhalation, and gastrointestinal. The cutaneous is caused just when the infected tissues, wool, hide, and soil is turned in contact with the human, and secondly through biting of flies or insects that has the spores of anthrax. Inhalation is through the tanning hides or processing wool or bone while working in the factories of wool or bone. The third one, gastrointestinal anthrax, is usually caused through the undercooked meat or sometimes through contaminated or infected meat. Disease in humans. The cutaneous one are 95% cases were registered globally, and the incubation period for this is 2 to 3 days. Basically, the spores of the anthrax enter skin through wounds, and the fatality rate of this disease is from 5 to 10%. If the cases are not treated and they are not given a proper treatment, then it can cause septicemia and death in humans. Gastrointestinal anthrax. This one is the second type. It usually occurs within the period of 2 to 5 days, and by consuming contaminated meat or undercooked meat, the fatality rate is higher in comparison to cutaneous, that is from 25 to 75%. Inhalation anthrax. It causes respiratory distress in humans, and the incubation period is more, that is from 1 to 7 days. In the first phase, the person who is suffering from the anthrax has mild fever and fatigue, and in the second phase he or she have the problem in breathing, and also it occurs dyspnea, stridor, cyanosis, mediastinal warning, and death in 1 to 2 days. And this fatality rate is more in comparison to the gastrointestinal and the cutaneous, that is around 75 to 90%. How we can control and prevent this disease in humans. Humans were protected if we prevent this disease in animal, and this will only be happen when the animals were properly treated. There must be a trade restrictions, like while processing wool, bone, people should wear gloves, masks, and we should improve the industry standards so that people not suffer from this disease. And there is also a post-exposure antibiotic prophylaxis for the people who are working. In animals, how we can control if the animal is suffering from any kind of anthrax, and and it is showing the disease features, then it should be reported to the authorities. and we should not open the carcass until the area remain free from anthrax. We should minimize the contact with the animals that are suffering from the anthrax bacteria. We should wear protective clothing, latex gloves, and face masks. In animals, necropsy is not advised, and we should not open the carcass. And the samples of the blood should be collected in a proper container, and we should always cover the site with disinfectant soaked bandage to prevent the leakage. And they are treated with the two antibiotics named penicillin and tetracycline. In humans, there is a cell-free filtrate that is produced from a virulent strain, and it contains no whole bacteria, died or alive. And there is also a vaccination, 5 IM injection over 18-week period, an annual booster. This vaccine is manufactured by Bioport Corporation. The primary immunization series consists of 5 intramuscular injections given at day 0, week 4 in the period of 6, 12 and 18 months. Surveillance. The only thing that is required to prevent these diseases is surveillance. That how we can control by giving the proper measures to prevent this disease. It is possible through 3 levels, that is local level, intermediate level and central level. In case of local level, it usually records the result like official contact with the infected person and the point at which surveillance data collected. In the intermediate level, the reports from the state health department and the veterinary department. In case of the central level, this one is at the higher level, in which it takes a report from the local and the intermediate level.